Hello again. Thank you for watching my YouTube channel in English, Just the Talk. If you like the content, please subscribe and send it to your friends. I've talked several times about different things, including insulin resistance and visceral fat and dementia and vitamin D and lung transplant and many other medical topics. The other day I was visiting somebody, and after the dinner they played a game. In that game, everybody was asked to pick something from a hat. And the question that I got, which I had to answer, was what would you ask for, or what would be your wish if you happen to come across Aladdin's lamp, the magical lamp? As a comedy, I just said that, well, I would ask for 6 more. But to be serious, I answered that I do not want 3 D's or things that start with D as I get older. One of them is dementia, one of them is depression, and one of them is disability. How would you feel if I tell you that there is a pill that can take care of all 3? We have often talked about new blood tests, new equipment, new diagnostic testing, new machine, new invention as at medicines that helps this disease, that disease, prevents heart attack and strokes and everything. But they're all either new drugs or equipment which are highly expensive, not covered by the insurance. But today I'm talking about something which is very easy, does not need money, and anyone and everyone can do it any day, anytime, any place. I'm talking about walking. And you might say, what are you talking about walking? Well, the studies have shown that the walking takes care of diseases, depression, and dementia. And that's what I'm going to talk today about briefly. So to start with, everybody thinks that you have to do 10,000 steps, and without that, you can't get enough benefit. So they did a study where they took about 100,000 people, not a small group, and they compared people that walk 2,000 steps to the people that walk at least 8,800 steps. So 2,000 steps minimum to 8,800 maximum. When they compared people with 8,800 or 8,800 steps, found out that the overall mortality, death, another D, from all cause decreased by 60%. Think about it again. If I give you a pill that reduces chance of you dying from anything, 60%, wouldn't you like to take it? So the minimum steps were compared 2,000 to 8,800, and the mortality decreased by 60%. But the interesting observation when they plotted the curve of people that were walking 2,000, 3,000, 4,000, 8,000 or more, they noticed that even when they compared 2,000 steps minimum to 4,000, which is not impossible, very easy to do, they found that the overall all-cause mortality decreased by 37%, substantially lower. So the benefit starts at much earlier levels of steps than trying to reach 8,800 or 10,000 steps, which has been talked about all the time. So that's the death, all-cause mortality. Now, certainly we know that the walking helps the blood pressure and diabetes and dementia and death and depression. So I'm going to talk about each one a little bit in the next few minutes. There is an area called hippocampus. Hippocampus is a very small area in our brain, but people have known that hippocampus organizes the memory. Different things that happen, they get organized, and the external world as we see it is stored in our hippocampus. In Alzheimer's disease, when people have done studies of MRI of the brain, they found out that the hippocampus volume goes down. Whenever they talk about using any kind of treatment for memory loss or Alzheimer's disease, they compare the MRIs to see if the hippocampus volume goes up or not. So the hippocampus is the storage of the memory and is required for our memory or prevention of dementia or treatment of dementia if you want to increase the volume. So again, when they ask this little bit older people to be in a study, and they had asked them to walk 40 minutes, moderately intense, 3 times a week. Again, not daily, not running, but just walking 40 minutes, brisk walking, 3 times a week. And they did the MRI. What they found out, remember, normally as we age, our hippocampus volume goes down by 1 to 2% each year. Now here, when they took these people and measured it in a year, walking 40 minutes 3 times a week, they found out the volume went up by 1 to 2% or even 2%. And not only that, but their memory, their organizing skill, their cognitive function, all improved substantially when the hippocampus volume was increased. Certainly we know that hippocampus is involved in memory storage, so that was not a surprise. Now, how does this happen? And one of the things that they talk about is BDNF, brain-derived neurotrophic factor. BDNF is released from the brain, the hippocampus, the cortex and hippocampus and many other areas, and it increases the neurotrophic. It's like a fertilizer, so-called miracle grow, that stimulates our cells. But there are synapses, the two brain cells coming together, communicating with each other, which is the memory. The synaptic connections are also improved. So it is a neurotrophic factor where the BDNF is affected. There are a number of things that can stimulate BDNF formation, and I'm diverting a little bit for BDNF itself. Brain-derived neurotrophic factor, you can increase by high-intensity exercise. You can increase by simple 40-minute brisk walk 3 times a week. There are also foods that you can take that will increase it. And if your BDNF goes up, your hippocampus goes up, your cognitive function improves, your memory improves. The stress causes BDNF to go down. Polyphenol, anything which has the polyphenol in your diet with berries, for example, or some people say omega-3. There are some people who think it is the green tea, and many other things will increase the BDNF. Intermittent fasting can increase the BDNF. So all these things you can combine. These are simple things. Eating more berries, doing an exercise, eating intermittent fasting. This will cause our BDNF to go up, and that will prevent or treat the dementia as it increases the BDNF, in turn increase the hippocampus volume. So exercise can do it, but simple walking for 40 minutes can also do the same effect, and this was proved by the MRI, not just test. Our brain has several chemicals that are increased, that are rather released: dopamine, serotonin, and endorphins. These are important functions. Dopamine is for fun. For example, when we eat sugary stuff, ice cream, or that donut that we love, or the social media, WhatsApp, where we get more thumbs up. Dopamine causes the pleasure. Serotonin is involved in the depression. As you know, serotonin is related to many antidepressant drugs. Endorphin is for the pain. So our pain is reduced when we take something like morphine, which is produced by the body. That's why it was called endorphin. So walking increases the dopamine, gives you a positive effect of pleasure. The walking increases the endorphin. So our aches and pains kind of disappear or go down. And it increases the serotonin, and that also causes our anxiety, depression to go down. There was a study done where they compared people that were given Zoloft, which is an antidepressant, also called sertraline, and they had 200 adults that were followed for 4 months, 16 weeks. A group was given just the Zoloft, the other group was given advice to walk, again, brisk walking, 30 minutes, 75% of their maximum heart rate or maximum oxygen consumption. And at the end of 4 months, the effect of walking was exactly same as taking Zoloft. And this is a longer lasting effect. So it is not like people that took the Zoloft had the long lasting effect. Now, certainly, the Zoloft effect takes time. Walking also takes time. Now, we are all stressed out nowadays. And what happens because of the job, because of the family, because of the income, because of the inflation, because of the wars. But there is always a low grade of stress happening in our life, modern day life, all the time. And that releases cortisol, which causes sleep disturbances. It also increases our sugars to go up, and in turn causes our insulin to go up. The insulin causes sugar to go inside the cell. However, over a period of time, we develop insulin resistance. The stress, the cortisol, the insulin causes our body or the fat around our belly and in visceral fat to go up. And this causes diabetes, metabolic syndrome, blood pressure, etc. This low-grade stress you cannot avoid if you're living in a modern society. So to reduce that, the walking is the best thing. Because when we walk and do a rhythmic movement, right, left, another system gets stimulated called parasympathetic. Our mind looks at changing scenery, walking outside, the sunlight, changing places. And that stimulates parasympathetic system, which reduces the effects of the sympathetic system, which is the cortisol, adrenaline, insulin resistance, etc. People did a study in diabetics when they were asked to walk and they measured the hemoglobin A1C. Again, important thing is these people were asked to walk 10 minutes after each meal 3 times a day. Their hemoglobin A1C went down by 0.5. You might think this is not that great, but when you compare what is pre-diabetic to a diabetic, you will know that 0.5 is substantial. Again, no drugs involved. So walking allows our muscles to consume the sugar without needing the insulin, and that insulin resistance which has developed is reversed if you lose enough weight and if you do enough walking. Now, when they compared 30 minutes once a day versus 10 minutes 3 times a day, 10 minutes 3 times a day was better than 30 minutes once a day. So essentially, it also helps the diabetes. Last but not least is something called mitochondrial function and cleansing of our cells. We have a system where our mitochondria become dull, old, like an old generator. Mitochondria are the powerhouse in our cells. Walking changes that. It produces more mitochondrial function, and so our energy level, the brain fog, the so-called brain fog, also reverses. So the walking helps everything. It is better than any new pill, but consistency is required. Our body does not respond if we do walking for 2 weeks or 1 week and then stop and then do it only on a weekend, because our body treats that as an aberrancy and does not respond. So we need to consistently walk 3 to 4 times a week. We need to walk 10 minutes after each meal, and we need to avoid losing the sleep, reducing the stress, and that will help. I hope you have found the answer to your Aladdin magic lamp right here by doing the walking. Thank you. Happy walking. If you like, please subscribe. Have a nice day.